very movie when I'm around. Yeah, so I'm gonna put down my share my screen and put a presentation about which I'm going to use also to introduce myself a little bit. Not to waste time. Here I go. I think this is the way. Just let me check if that's fine for everyone. Can you see? I guess. Yeah. So as it's over there, I work as a child and adolescent psychiatrist since the end of my medical training. End of medical school. That was 6 years, then 4 years of residency, and then it's already 3 years as a not consultant, but as a standard, so to say, specialist doctor. I have been a member of many different organizations, which I am going to put down here. This is a little bit of an overview of my participation in different associations. So I've been always the opinion that one has to be a part of something, has to bond with others, and has to band with others to change something or to learn something new or to actually expand the focus of what you're doing. So when I first started med school, I joined IFMSA, that's the International Federation of Medical Students Associations, was a member of the local committee, then of the National Federation, like for the board of the National Federation. And then from there, I just participated in many workshops around the world, many assemblies and many different meetings and also task forces. Later on, after med school, I continued onto what was shown to me for some of my colleagues into what is some sort of IFMSA, but in the psychiatric field in Spain. That's the AEN, that's the Spanish Association for Neuropsychiatry. It's one of the 3 scientific associations that works in the psychiatric field, and the AMSM, that's the regional branch of it, that's based in Madrid, where I currently live. And from my participation in there, I've also been a member of the board of Mental Health Europe for the last 3 years. And if things go well, I'm going to be presenting myself for a candidate for the next 3 years as a member of the board. It was actually funny to see that in the program that tomorrow people from IFMSA are going to come, and people from Mental Health Europe are also going to come. That's such a small world that we live in the associations and in the associative and social networking in this field, mostly when people want to go out and start to come out on regionals and not national and international levels. So the first thing I want to talk about is where do you want to stand in the association field? Where do you want to be? There are, I would say there are like 2 main groups of associations or scientific societies, so to say. So the groups that participate more on a political, so to say, goal, a goal that people who want to change the world, want to make a political stance about something, and or even if they are only composed of professionals in the mental health field, or if they are just, so to say, scientific societies. For example, in Spain, we've got the Spanish Society for Psychiatry, which is theoretically only a scientific society, whose main focus is the scientific training, workshops, and continuous formation of professionals. While, for example, at the AEN, even if we partake in scientific, so to say, or formative activities, we also have a very political stance in which we address issues such as the additional protocol to the Oviedo Convention, the right for zero contentions in psychiatry, no sports contentions, no mechanical restraints, the fight for a more human, a more community-based psychiatry, and that's also part of a political stance. There are also many associations and societies that only partake from one specific kind of professional, from registered nurses, psychologists, etc. Or there are others that take all kind of professionals. For example, as I say, the AEGEE is right now one of the most broad associations in that sense. At the end, as I say here, Virchow was right when he said that medicine is just politics on a small scale, or the other way around, actually. But each stance that you take, and actually only partaking in the formative scientific method, makes you also part of that technocratic, techno-focused society. And I believe that there are many other goals that one has to pursue in this field, because it's actually one of the fields in which human subjectivity and not just scientific, so to say, issues should be at the core. There are also some specific associations that are destined for younger people. One first should state what is a young person. I'm right now 30, and I still consider myself one of these younger people, but I'm not sure how will that be maintained by my psyche. In that sense, there are some specific associations which I met for residents, physicians in training, psychologists in training that have a very particular goal of empowering them, providing for better labor conditions, but also as a safe haven, so to say. Or actually, most scientific societies and most of the big associations and societies also have youth committees, also have youth residence sections, which also help younger people organize and put upfront the needs, so to say, or the what they want to do, and the desires to change the world, of course, as well. Why I believe everybody should actually be a part of an association or a scientific society or something, at least. First of all, because the union, not only as labor, as people who work, as working people, but also as a collective with its own goals and its own desires and its wishes for a better society, a better further impact, and it gives us a lot of potential in in negotiation, but also in providing our opinion, and to be also policymakers and to lobby and be advocates for what we believe in. In this case, I believe that if we don't band together as a whole, it's very difficult that we get to achieve our goals. For example, of dismantling the additional clauses to the Oviedo Protocol, which actually are a thing that go against the European Conventions for Disability Rights. They also provide us a further impact, not only on the societies as I said there, but also on ourselves. They are so societies and associations give us further training, further views, a broadening of political, scientific, personal, and work views and everything what's there. And I believe that enriches a lot a life of a professional life that otherwise would be pretty dull and pretty reiterative once we get in one particular field of work. And of course, training, as I say, because right now, apart from the from what the pharmaceutical companies could provide us, there is no other real true training option in our fields besides scientific societies and scientific or professional associations. My presentation is just finished. So it was a really short thing, just to present you with this and just to reinforce the impact of what I think is very important and what is that everybody should band together in whichever place, group, society, association they believe they can fit in better, but that would give them as a professional a lot of strength and a lot of working power to keep working and to keep motivated and to keep up to date with everything that's around in this continuously changing world, and not only the world but also the mental health fields. So thank you very much, and I will already stop at this point.
Thank you so much for sharing. Given that we have a moment left to actually ask questions, I would like to open the floor for anyone who has a specific question. In the meantime, if you don't mind, I will start asking the first question. You say that it's very important to be part of an association, say scientific society or any sort of association. What has brought it to you? So being part of an association, what has brought it to you in the long term when you were a student?
So when I was a student, IFMC, it's a very funny question, but when I was a part of IFMC, I believe that I was part of something really bigger that could actually do some things and change the way students were treated and the way medical students as a whole could impact the world. That was like my perception. What has really brought to me is that it was also the feeling that well, not just a feeling, but what I really found out when I left IFMC, because I finished being a medical student, is that I didn't like medicine at all. I just liked IFMC. I liked the topics we were discussing. I liked the students' organization. I liked that spirit. And that actually brought me to the psychiatric field, because there was a field that I thought I could make more impact in this kind of way.
Thank you. That is a very clear answer to the question, actually. I would like to open the floor for anyone else who might have a question. Feel free to write it in the chat or to open up your mic if you have one. And I'll give it a minute, and otherwise I obviously have more questions. In that case, I would like to ask you another question, and it's a follow-up on what you actually already said. So it has brought me that I didn't necessarily see medicine as my clear goal after being part of this for a long time. How did you eventually find out that psychiatry would be your way to go? So how did that process eventually go?
So in that case, it's a very also it doesn't only have to do with my feeling that I didn't want to do medicine and I didn't want to do something else. No, it also medicine in the sense of clinical medicine. I mean the usual image you've got now: the doctor with the lab coat, with the patient rack and the blood tests and sampling, and I'm going to order this and do that and do a differential diagnosis. And I thought I could go to another place and do different things. So actually what catalyzed that, it's very funny, because what catalyzed that was my own personal therapy. I also started during that period, because of other issues. I started a personal I started seeing a psychologist, and that totally changed my view on what mental health was. Because before that, for me, psychiatry was another medical field, was another place where you just heard a patient, you wrote down some things, and you put the patient in some drugs, and that was it. And then I noticed there was something else to mental health. There was something about talking, about bonding, about changing, that didn't have to do at all with medicine or with some, so to say, a standard scientific criterion, but to being human, to the more humanist side of medicine, to the more humanist side of life, so to say. And from there, I just think just like changed, and a good friend of mine just introduced me to a place to start my residency, in which psychiatry was not conceived as a really medical thing, a biomedical thing, but also more community-based service. I'm reading one question, if you don't mind that I continue. Or do you want to? There was one written question over there.
Yeah, so maybe Veronica, if she would like to, she can ask her question herself.
Hi, yes. Students and young people are often discouraged from joining the youth association because of the workload and the stress that comes with it, and trying, to balance work life, student life, and working youth associations. And we're oftentimes also scared of not being taken seriously. So we think that our work will not lead anywhere. Do you have any advice from your experience on how we can encourage young people to still participate in activism, and perhaps how authorities can take young people more seriously? What would be the way forward, do you think?
Well, in my experience, the only way to be taken serious is to be serious yourself, so to say. It's true. There was this anecdote about one of the local committees in IFMC in Spain was known to be the one with all the higher grad, like the students with the highest marks would be in there, and they would have a huge affluence of people working with them. And it was really funny because I said, yeah, we don't know why everybody wants to be like us. We're just like the guys who study a lot, have good grades, and do other things as well. I would say that the workload is a very subjective thing. Of course, everybody wants to have the best marks, and everybody wants to have some off time or some leisure time, but everybody can get some time off. I don't know, 15 minutes, 20 minutes of your day can be used for this. That's a very personal question and a very personal thing. I don't know. I don't feel you should force anyone to participate or like blackmail someone into participate, but actually tell them that it's like it doesn't take a lot. Your implication level doesn't have to be like very high. You don't have to be a member of the board who's in constant meeting. You can be just a member who goes to the assemblies, who participates sometimes, who comes to some activities that we organize and be part of it. And eventually you'll see if you like it. If you like it, just you're gonna take deeper steps into that. If you don't, well, that's your call. People can be taken seriously if, as I said before, if you don't use youth as an excuse to be unserious. You have to be as serious as you can. I mean, serious in a good sense, in the sense of being formal, of being the person that says, yeah, I'm doing this, but look at me, I'm not stopping my work, I'm not stopping my things because I'm in association. I'm still doing that, but I'm further implicated than you. if I'm further implicated than you, I have the higher moral ground here, so to say.
Thank you for the very clear answer. And I also see Veronica saying thank you in the chat. Are there any more questions?
Dr. Gomez, may I ask a question, please?
Of course, go ahead.
Yeah, okay. Well, we with doctors, mental health workers, we're most interested and work with psychopathology, not actually a normality, but abnormality. So we need, I think, considering youth mental health, we need some preventive precautions, especially in primary care. So I would like to ask if you have in your country, if you have a structured guideline, so in order to apply it on young people, and not for psychopathology, not to detect psychopathology, but maybe work in a community-based mentality, Mm-hmm. So do you have a structured guideline in Spain? Thank you.
We do have many different regulations and many different guidelines. Okay, so the Spanish mental health care system is divided into its 17 autonomous communities and regions, healthcare systems, and they are all different. So it's a bit complicated. But yes, the theory, at least in theory, we do. There are guidelines to be aware of youth mental health. There are some guidelines to when to go to the mental health services, what to not, when to depend on other people. There should be guidelines, at least in paper it works. Reality is we're like completely collapsed. at this point. And I think it's one of the topics we'll be talking later on in the discussion. But I would like to advance to you that yes, there is, but at the same time there isn't.
A clear answer, and I also think that we will get into this in more detailed when we get into the panel discussion. I would like to open the floor for any more specific questions that there are. If there aren't any, then we can go on to the panel discussion. I see Eva has raised her hand. Eva, would you mind to ask your question yourself?
Yes, hi. Thank you, André. So I would like to ask you, what are the main challenges that you feel that the students face nowadays, and how do you think that we as students should approach them?
Just for one clarification, you said medical students or all kind of students?
Well, I'm a medical student myself, but you can speak generally for.
No, thank you. No, I mean, I was actually thinking about medical students, but I don't haven't heard you properly. So for me, main challenges of medical students are, well, first of all, getting, as the question of Veronica before stated, get off of that whole amount of workload, like the huge amount of workload that there is, and have the possibility to take a time to take a step back and come into medicine, come into humanity, or into the career as a with a broader option. If you just if you as a medical student start the career and keep on just with the medical guides, the clinical guides in your head, you will lose track of what the patient is, and what the patient is a person, and that person is part of a society, and there are many other things that affect the people. In the case of mental health, is something that we see lots of times, and we see in a very so to say, very dramatic and very direct way. But in all kind of medical specialties, there is a societal part that we as medical students most of the time don't recognize, and are taught not to recognize until it's a little bit too late. That would be the first one. And the second one would be to maintain, it's probably in the same direction, but to maintain, to be able to maintain a degree of independence from higher institutions, I would say private institutions, in this case of pharmaceutical companies, that all the time are behind you, are constantly haunting you for your part in the market. No, I have a strict no pharma-free policy. Not that I don't prescribe drugs to my patients, but I don't accept visits from any pharmaceutical visitant or a commercial. I'm strictly against that, and I'm happy also to have been able to do that, because not everybody in my field has been able to do that. Sometimes they have been like forced by the elderly to do so. Those would be my two, because I think medical students should have, first of all, a broad view of what they're doing is not just a science, but also a human activity, an activity that's a core to our society as a whole, and that when each single decision you're taking in the medical field is affecting society as a whole. When you decide to prescribe one drug instead of another one, which is cheaper, you're impacting the medical system, for example. That's just one small example. And that one's one. And second, be as independent as you can.
Thank you for sharing, André. I see one last question by André. So André, if you still have your question, feel free to unmute yourself.
Yeah, this may be a bit of a mean question to ask someone in psychiatry, but we talk a lot about breaking the stigma around mental health. And what I see happening is that the people who talk about it are usually people who have been affected very heavily. And I think that often it doesn't include large parts of society, and that's one of the reasons we keep having stigma, because it's not very inclusive. How do you think we can talk about mental health including more people? Because I feel I always run into the same kinds of people when I'm advocating for like positive mental health.
And you're totally right. It's true. I mean, it's true. We tend to bring in the hardest hit patients and the people who have been like really affected, and the ultra diagnosed, and people who have been victims of well, psychiatric maltreatment at some point, and they have a right to complain. And they have the right to be this kind of people who say, where I have been affected by the system. And even if not, the people who can be there are the ones that have like the strongest affections or afflictions. I think one of the best way to talk about stigma or mental health stigma is just take a bunch of normal people, take a bunch of people, you like a truly random sample of people from the street, and say, well, let's make a panel with this. Let's make a panel. What do you think about mental health? Have you been with a psychologist? Have you been with a psychiatrist? Have you ever I don't know, what's your feeling about it? Like really taking the conversation out of the psychiatric wards and to the streets. Because it would surprise a lot of people how many people have been in therapy. As I told you before, I myself have been and am currently in therapy for, well, first I believe every mental health worker should be in therapy, him or herself, but that's another question. But I think that's a very interesting topic. I think it's yeah. It's just bring the question to the general public, because general public is the one that is stigmatizing, that is, but also that is part of the mental health system. And they most of the times don't recognize themselves in that. When you talk about mental health or psychiatry, people who have been with a psychologist at some point, or that take antidepressants or anxiolytics prescribed by a general practitioner, they would say, yeah, no, that's not mental health for me, that's another thing. And it's no, just take part in this discussion. This is also about you. I hope it helps.
Thank you, André. I see no other questions, so I suggest that we go into the panel discussion. So for the panel discussion, I will invite everyone on the panel to shortly introduce themselves and give a little background of who they are. And maybe it would be, if you have been part of a student association when you were a student, please also let us know. It might be interesting for the students that are here. And from what I understood, we have also a short presentation by Mehmet. That's why he also tried to screen share in the beginning. So let's first have all the panelists introduce themselves, and then Mehmet can share his screen and give the short presentation. So if it is all right with you, I would like to invite Ivona first. I've seen you, but I don't see you now.
Hi, I'm here.
Perfect.
Hi.
Go ahead.
Hi, my name is Ivona. I come from Croatia. I'm a psychologist, and I'm currently working in Croatian Youth Network, which is in Croatia the largest alliance of youth organizations, and we have currently 65 members. So we are also full member of the European Youth Forum, and we are recognized as a National Youth Council of Croatia. So I don't know, I think this is enough for the beginning, and that's all from me for now. Thank you.
Thank you, Ivona. Yes, and a short introduction is perfectly fine, because we will get into more detail during the panel discussion itself. Elisa, would you mind sharing a little bit about yourself?
Yes, hello, I'm Elisa Duidolf from the Netherlands. I'm a researcher in the field of mental health research, and I work at the Trippels Institute, which is the National Institute for Mental Health and Addiction. And at the Trippels, we do all sorts of research, but also policy advice, and we develop interventions. And we do process evaluations of these interventions, and also focusing on youth. And I specifically work at the Department of Youth Mental Health and Prevention. So that's also why I like to be present here today. Hope to share some of the things I know with you guys. About me, I have expertise on social inequalities and adolescent mental health. I did my PhD on that, and also my prior work on universities focuses on that. So I think that's it for now.
Thank you, Elisa. So could I invite Nick to share a little bit more about himself?
Yes, we can. Hi, Liz. Hi, everyone. Thanks for having me here today as a speaker. Hi, everyone. My name is Nick. I guess so that the kind of general term I use to describe my kind of label is I'm a youth social worker specialising in mental health and participation, based in the UK, where I provide one-to-one support for young people in the local area. I'm also a national participation officer at the Anna Freud National Centre for Children and Families. And I'm the volunteer director and youth involvement lead at Euro Youth Mental Health, who I'm primarily representing today, hence this fancy background. Yeah, I think something that we do a lot of is very much about trying to ensure young people's voices are heard in all of these pieces of work, including research and kind of one-to-one support and therapy. Yeah, I'll leave it at that. Thanks for having me today.
We're happy to have you today. May, could I invite you to share a little bit about yourself? So I have no sound for you, May. Does anyone else experience the same issue? Yeah, okay. Don't worry, May, take your time. Perhaps the microphone, you can change the microphone in the left corner.
Can you hear me now?
Yeah, perfect. Loud and clear.
Perfect. So my name is May. I'm from Amsterdam, the Netherlands, and I run my own mental health charity called Let's Break the Shame. I've been struggling with a lot of mental health issues the past few years, and I really miss the connection with others who are going through the same. So I've set up my own charity, and yeah, we connect people who struggle with their mental health by events and online campaigns, but we also focus on education. So we go to schools to give workshops there, but we also go to companies to see how they can work with their employees and focus on mental health in the company itself. And I think that's a little bit about me for now.
Perfect. Thank you very much for sharing, May. May, could I check in with you for one thing? So I wasn't sure whether Iris is joining us as well today. Iris de Wit.
No, she will be here today.
Okay. No, that is good for me to know. Thank you for sharing. Then I would like to invite Matthew.
Hi, everyone. Thanks for the invitation to be on this panel. It's an honor to be with such experts and people who have experience in working with youth. I'm Matthew Bartolo. I'm from Malta, and I run one of the biggest private practice in Malta, and we cater for sex, family, and health issues, mainly mental health. I would consider myself as an activist when it comes to fighting mental health stigma, but I'll talk about that later on during the panel discussion. I'm also a counselor, psychotherapist, and supervisor.
Thank you, Matthew. That was very short and concise. Then I would like to invite Mehmet to give a little bit of introduction about himself and share the presentation that he has for us.
Okay, thank you. Hello, everybody. My name is Mehmet. I'm a psychiatry doctor. I'm from Diyarbakir and working also in Diyarbakir Gazi Ashargi Training and Research Hospital. And well, we here have inpatient clinics of 20 beds, and community mental health service in this month we will establish, I hope so. I work with mood disorders, psychotic disorders, and mostly with adults, but of course interested in young adults and maybe late adolescents. And so, I would like to, I think for my introduction is enough. If you have any question, of course, I would like to answer. I have prepared a presentation of suicide, you know, so to younger for you here, and I'm sorry for this excitement. And can we please start? Yeah.
Yes, go ahead. Yeah.
Okay. I would like to start my presentation. Is why is suicide? Why is suicide? Because suicide is third leading cause of death in adolescent. So that makes it important. I previously maybe mentioned, as I'm working with mood disorders and cognition, suicide is suicide is we can see it as a result of falling of our treatment in especially mood and psychotic disorders. I will tell you about why. Let's start with definition. I want to start with a Durkheim definition of Mr. Durkheim. Emile Durkheim is a French sociologist. He said he defined the suicide as any death that is a direct or indirect result of positive or negative action by a diseased person with the knowledge that it will result in death. So let's go with the definitions. What is a suicide attempt? Suicide attempt is an act that is defined in this way but is suspended without causing death. So what is suicide? What makes it? What's the description of a suicide? Suicide is a death because of a delirium patient, a death of a delirium patient because of throwing outside from the window is not a suicide. But a death of Mapri or Harakiri or suicide bomber is because the person who did this action, this attempt, has inner willing to die. So we call it scientifically as suicide. Sorry. So we have some definitions as fatal and non-fatal suicidal behaviors. Suicide, when we call suicide, that means it results in death of that person. But when we say suicidal attempt, it means that that person attempted suicide, but no success, with no success. So non-fatal suicidal behaviors may be classified as suicidal attempts and self-mutilations. In self-mutilations, there is no conscious suicidal intention, mostly is in adolescence, or maybe personality disorders, borderline or antisocial personality disorders. For suicidal behavior, this term is mostly used in Europe for self-mutilative behavior. This is mostly may usually done for punishment. So suicide has three phases. First of all, the person who wants to suicide starts to think about suicide and plan it. Then attempt, and if success, we call it suicide. It may be due to a psychiatric condition, or maybe a sign of serious illness. Suicide may be a sign of serious illness that is not specific to any psychiatric disorder. Suicide may be a reaction to stressful living conditions, or in people with severe mental disorders. So it is a complex behavior with biological and sociological and psychological origins basis. What is suicide? Let's have a look to epidemiology. According to World Health Organization, about 800,000 people die every year by suicide. That means every 40 seconds, one person dies because of suicide. Is the second leading cause of death among 15 to 29, but is third leading between 15 and 24 statistically, and this has prevalence of 12 in 100,000 people. What is statistics in Turkey? I could reach the statistic because of 2018, about 2 years ago. It's less than the median, the mean of Europe and United States, and also in the world, is 3.9. Accurate suicide rates in Turkey is 3.9 in 100,000. Of most of are male. And what is the race in Diyarbakir? Diyarbakir, well, I should tell about Diyarbakir a little bit. Where it locates is Diyarbakir locates in the southeast of Turkey. It's actually mostly has a culture of Middle Eastern, not actually European. So that may reflects, so the orthodoxy of religion here is much more than the mean of Turkey. So that may be why the rate of suicidal attempts in Diyarbakir, suicide rates are lesser than Turkey. So about 2/3 of suicides are younger persons between 15 to 34, mostly by hanging in Diyarbakir and gunshot. Why gunshot? Here is much easier to gain a gun or to reach a gun, unfortunately, in Turkey and also in Diyarbakir. So let's go on with etiology. And there are sociological factors. I want to just tell about Durkheim's story, why he classified into 3 types. Durkheim is, as I told you, a French sociologist. His study is the first for emphasizing suicide, why people commit, and the sociological and psychological measures resulting in suicide, affecting suicide behavior. So he classified it into 3 types. Suicide is, first of all, is egoistic suicide, is not strongly integrated any social group. The person's not strongly integrated any social group. They have no customary or moral rules. As let's say, people, unmarried men, more vulnerable to suicide because he has no customary or moral rules. The second type of suicide is altruistic. This is we can simplify like a Japanese soldier, sacrifice for his country or in Turkey also, martyrs. They die for their country, especially in armies. Anomic suicide is it's moral confusion and lack of social direction. Is related to social and economical upheaval. It's less to give a sample is drastic change in when occur in economic situations. Psychological factors. There is about in the last century, Freud tried to describe the psychological factor in melancholia, his book, as, to sum up, aggression turned inward against an introjected, ambivalently categorized love object. In Menninger's theory, he also, based on Freud's theory, he says inverted homicide because of a patient's anger toward another person. This retroflexes murder is either turned inward or used as an excuse for punishment, according to Menninger. Well, currently we use mostly cognitive therapy, and actually more evidence-based therapy is cognitive therapy. In cognitive therapy, Aaron Beck described the depressed patient. He described him as he viewed himself as defective, inadequate, diseased, and deprived, and thus worthless and undesirable. Also, as rejecting and unsupportive by making too many demands, or also they view these depressed patients, they view future as hopeless, since they do not believe that they have internal and external resources to solve their problems. We have tried of Aaron Beck. He says the depressed patient sees himself or herself bad, his or her past bad, and the future bad. This is associated with this bias, with this idea. So in etiology, some biological and genetic factors currently have been detected, like diminished central serotonin levels negatively. It correlates with suicidal behavior. Some investigations of serotonin levels of patients with depressed patients attempted suicide. They found out, many studies found out low levels of serotonin, which we try to increase in the blood and in the CNS in order to as an antidepressant effect. Sorry. Polymorphisms of tryptophan hydroxylase also, it causes decreased serotonin levels and results in increased suicidality. Some monozygotic twin pairs have more concordance for suicide. Actually, my aim for about this presentation was to tell young people about what makes a suicide severe. I mean, if you see somebody around you, or it may be you yourself, how can you understand this suicide is severe? This suicide ideation is severe, is lethal. So I would like to tell about more risk factors. Suicide is actually often a preventable cause of death.
Mehmet, I'm very sorry for interrupting you. There's about 1 minute left in the timing. So would you mind keeping it short and concise from this point?
Of course, just risk factors. Okay.
Thank you.
Some risk factors, sociodemographic, clinical and conditional and familial risk factors, I would like to tell. Completed suicides are higher in men than women. Women attempt suicide 3 times higher than men, but completed suicide rate is higher in men. The methods men use are more lethal. That's why completed suicide is more common in men. Suicide is rare before puberty, but adolescents and young adults of both sexes are at higher risk for suicide attempts and generally less fatal methods, such as taking drugs or self-mutilative behaviors. Suicidal lethality increases with age, I would like to say, and unmarried men, divorced or widow women are at higher risk. Some clinical factors, the most predictive factor is previous suicide attempt. Clinically, this is the strongest risk factor for suicide, and suicidal thoughts, plan, a history of psychiatric illness and alcohol abuse, especially less than 30 years of age, or any chronic medical condition is a big risk factor. Active suicide plannings and preparations, such as writing a will, is a high risk of suicide. Comorbidities of severe psychiatric disorder in more than 90%, most in depression, and most lethal is in psychosis, schizophrenia, and bipolar disorder. Parasuicidal behaviors, I mean self-mutilative, self-injurious behaviors, mostly common, they are common in personality disorders like borderline and antisocials. Loss.
I'm very sorry for interrupting you again, Mehmet. But we do want to allow for a lot of time for also interactive discussion.
Okay.
So would you mind sharing 1 sentence as a summary, and then we can continue to the panel?
Of course. Sorry. My last summary is, my summary would be that, sorry, I just.
Thank you, Mehmet. I'm very sorry for interrupting you.
Okay, no, it's no problem.
You don't have to show it.
I just want to conclude, well, I want to conclude that the suicide is a psychiatric emergency, is a medical emergency, and all suicide attempts should be considered as important. The severity may vary depending on its cause and risk factors. And in cases that cannot be helped in primary care, they should be referred to hospital via emergency call. Thank you very much for your patience.
Thank you, Mehmet. So thank you, Mehmet. When you accepted our invitation for joining the panel, you thought it was important to share some of your thoughts on suicide. So thank you for doing so. I would actually like to open the panel discussion so that we have a little more time for actually sharing thoughts among the panelists from the different countries. And I would like actually to start off the panel on youth mental health. And before the conference, some students have indicated that they see in the last few years that youth has started talking more about mental health. And I would actually like to ask if this is something that you also perceive, and that you feel that there have been changes in how the perception of the field of youth mental health has been changing in the past few years. And if it is all right, I would like to invite Elisa, if you would like to share your thoughts on this.
Thank you. So if could you please maybe say your question again?
Of course, yeah, no worries. So before the conference, a few students have indicated that they see that there is a growing attention for youth mental health, specifically within universities, within social systems. Would you mind sharing some thoughts on that, whether this is something you recognize or not, maybe?
Yeah, I understand, thank you. Maybe first personal, when I was a PhD student in the Netherlands, the first there was actually little attention for mental health. And then when I ended, there was a psychologist for PhD students. They hired one. So that's, I think it reflects what you say. I agree that there's increasing attention for youth mental health. I think I also would like to say that it's important that we talk more about youth mental health in different organizations, in schools or in student organizations, because by being open about mental health, students learn that it's okay to share that you don't have a good day, or it's actually also normal to not be happy sometimes. And especially now during Corona times, with the virus spreading, you might say that being stressed or having some sleeping difficulties or experiencing anxiety may be a normal reaction to an abnormal situation. And it's important to stress, I think, that if you feel these, if you have these feelings and experiences, that you talk about it with others and that you get some help and guidelines to deal with these thoughts, because chronic stressors or extended sleep difficulties or anxiety, these are of course stressors and can cause serious mental health problems. So I think that's what I have to say right now. I'm really interested if others agree with me or have different opinions.
Yes, I would actually like to invite the panelists to also feel free to open up your mic and to also reply to this, because perhaps in Croatia, Malta, or the United Kingdom, the experience may be completely different. So feel free to share.
I would like to say that I think that people are starting more to talk about mental health. But I think that, well, in Croatia is really correlated with education and socioeconomic status. I don't know if people in different countries have also this problem. I think that because people who are more educated, they are more aware about different mental health services, and because they're more educated, they have better socioeconomic background, and they have more services available to them. So I think that for mental health becoming more available to everybody, we have to make it more visible to people in risk of poverty and people who need more support to have better life conditions in order to have better mental health.
If I can shortly react on that, I think I can relate to you, Ivona, if I pronounce your name correctly. I'm sorry if I don't. So in the Netherlands, we see that we do develop interventions or things for students, especially in higher education. And we see that those adolescents who are in lower educational levels, they are harder to reach. So we actually make interventions that more specifically target these groups. So yeah, in that sense, I agree with you.
Yeah, I agree with you. I think that that is really important because students who are like in those kind of who are learning about mental health, they will seek mental health before than others. But people who are like more in need, they are really hard to find. And I think that is something that we have to think about in the future.
So if I may, I completely agree with Ivona about economic status as an indicator of how people perceive mental health and how people access mental health. I believe that people are starting more and more to talk about it, but again, from different perspectives regarding the socioeconomic levels. So people in higher economic levels tend to get private practices, tend to be able to go to private consults, and tend to get a better outcome regardless of any other choice because of a better socioeconomic status. And I think that most, as I told before, I think that many people that reach mental health care in a superficial level, I would say superficial level, and going to a psychologist, but for probably not a low-key problem or low-key symptoms, or going to the doctor to treat to get treated with antidepressants or anxiolytics, or again some low-key medications. I'm talking not about neuroleptics, not about mood stabilizers or some second-degree medications. They tend to not to perceive that as mental health, just as another thing, just as I said, another issue, and not as much like inherently, as we said before, as mental health, so to say. And in that sense, I feel that the stigma and the looks about going to the psychiatrist, going to the psychologist, going to some mental health resource is still somehow related to be crazy, with all the implications of that word I'm using on purpose.
Nick, feel free to unmute yourself.
Cool. Hi, everyone. Yeah, so excuse my dog, Bobby. Someone's delivering another package to the door. So what Bobby's trying to say is, I think it's a really interesting discussion to have. So I work obviously with young people on the ground in the local area in a place called Hitchin, which is a kind of a small town in England that's just outside London. And it goes back to what you were saying to start with, Ivona, about the awareness of the socially economic fortunate, shall we say, in good stead, are able to think about things about their spirituality and mental health, because their basic needs are met. So they've got food, they've got shelter, they've got water, whereas people who are in poverty, or maybe even rural areas where there's no access to libraries and things like that, they don't get, their focus is simply getting to school on time, or making sure they can find the clothes they need to go to school, getting money because their family, going straight to work at 15 because their family is struggling, those sorts of things. That's not their priority. You think, I'm sure everyone's aware of Maslow's hierarchy of need, and it's not the ultimate sort of idea of life, but there's that kind of initial, like, in order for my mental stability to be good, I've got to actually physically be able to do stuff and survive. And there's an element of that, I guess. So there's, in my eyes, and in our bubble, we're all here today because we're aware of the importance of mental health, and that's what we're trying to do. It's nice to hear that we are all aware, though, that what we really desperately need to do is to be reaching those more smaller, less visible areas, should we call them, and bringing that in. And schools are a way to do that, because essentially and ideally most areas have schools, and children should be going to school in almost every country in Europe. I say almost because I know some places it's not necessarily as prioritized as it maybe could be. And I think, so with that in mind, I think so there's, like I said, there's the local thing where, and especially in the UK, it's very talked about. It's on the news. It's at least a headline on a newspaper every day. And there are billions of Instagrammers and things now in the UK. On a European level, we did an event 2 years ago, 3 years ago, at European Youth Events, and we did just a kind of general what impacts your mental health workshop. We had some like 80 young people, and I was just thinking about, that was amazing. That's reached all these amazing young people, but they're the ones who have, for whatever reason, managed to be in a place where they can think more about, how do I want to better myself after education, or separate from formal education, and take on these opportunities to go abroad. And I think for me, it is a bit of a false awareness that we're aware, we can see people who are good to talk about it, but there are obviously still lots of people who we want to talk to about mental health that we're just not being able to get to. Just a note as well, I think I created Euro Youth Mental Health, Ivona, because I did a master's thesis comparing a mental health service for young people with depression in Zagreb to a service in London in 2014. So it's nice to hear that it is slowly being, it is still, it's getting talked about, because I remember those conversations being really interesting. Yeah, just want to highlight that as well.
If you want, you can send me the paper, because I would love to see.
It's quite old now, but yeah, I'm happy to.
I'm happy you're already doing a little bit of networking here. So Matthew, would you mind sharing a little bit more about how it is in Malta?
Well, in Malta, we are talking more about mental health, especially that of youth. I think there's a long way to go, a very long way to go. I compare mental health to physical health. And when I see how in every school, from a very young age, kids are given classes of physical education where they practice sports. So we don't start teaching them about obesity and cancer, but we talk about enjoying sports, eating healthy, and having some kind of exercise to prevent obesity and cancer. But when it comes to mental health, unfortunately, even today here, we tend to talk about suicide and talk about depression and talk about all sorts of mental disorders, when really and truly we should be talking about mental health. And mental health, in my opinion, is the prevention, is the being healthy mentally. So I'd like to see more, especially locally and in every other country, more classes about resilience, more classes about how to take care of your sleep hygiene, how to take care of your own mental health, and empower kids to meditate, to do mindful exercises. And so in that regard, I would say that we're quite far from where I'd like us to be when it comes to mental health. Even when you see awareness campaigns locally, at least when we talk about mental health stigma, you would have mental health stigma, but then we always keep having the same videos showing us how people who are suffering from depression are stigmatized. So within the same awareness campaign, we keep promoting the idea of stigmatization, when I think such money can be used so much better if we have very short clips about how one can lead a happier life. And also, as a society, what we can do as a society to fight the causes of mental health issues. We in Malta, we start very young with kids having to go to class, sit on the same bench for 6 hours at a time, where they're listening to the same teacher or different teachers talking about different subjects and trying to impart as much knowledge as possible. And we are preparing them for work, for life, by ripping them off from their childhood, because we just make them sit there and do their homework after 6 hours of school, instead of teaching them how to have fun, how to use their creativity. So I would say that when it comes to mental health, there's a long way to go.
Yeah, Elisa, feel free to unmute yourself.
I'm looking for the hand, but I can't find it, so I'm just doing this. I want to say I totally agree with you. Working at the Department of Mental Health and Prevention, I'm like, yes, I agree. And I think you also stress a really important point about what is mental health, how do we define it? Because in the Netherlands right now, we're actually doing this research where we are grouping together with psychologists, but also with youth themselves. And we ask them, what is mental health to you? Because everybody uses a different definition. So if you are maybe from a medical background, you focus more on these mental disorders. Whereas in the field I work, we look at the whole spectrum. So from prevention to intervention. And I also find it really interesting what you say about we focus on health. Whereas if we look at the World Health Organization, they say there is no health without mental health. So, and actually being healthy is one of the most one of the things you can do to prevent mental health problems. So exercising, eating healthy, doing stuff with your friends. So yeah, I think it's a really important point to realize that everybody has their own perception of what mental health is. So if we talk about it with others, that might be a good starting question. Like, what is mental health to you? What do you mean by it? Because everybody, depending on your background and your training and how life treated you, you might have a different vision on that. So yeah.
And hearing you, Elisa, what I'm thinking is that maybe if mental health policy is discussed between different stakeholders as well. Sometimes I find that it could be taken over by the medical profession, where the medical profession are trained to look for the disorder and fix the disorder. But so if we have doctors preparing campaigns and policies about health, then that's what we'll be talking about. So having different stakeholders, including youth and youth workers and youth social workers who are on the ground working with youth, and having better outreach and equipping youth workers to be online and be present where people are, and use platforms like TikTok to give more and better hints and practical examples of how to take care of your mental health. I think that is a much better way of working on prevention when it comes to mental health of youth.
Yeah, so what you're saying is take the discussion also to the platforms that the young people are using. I see May raise her hand. May, go ahead.
Yeah, can you hear me well now?
Yeah, perfect.
Perfect. Yeah, I completely agree. And if I look at the situation here in the Netherlands, I feel that we talk about it, but at the same time, we also don't really talk about it. I feel like it's been addressed also from a government perspective, but I feel like there's no real actions being taken on that. So I see that too, and especially if I look at my work where we also focus on mental health education, the number one reasons for schools not doing that is mainly because they just say like, yeah, we're an educational institution, so we don't need to focus on that. We're just going to focus on maths, English, you know, all the general subjects that people need to take exams in. And I think that's a real struggle because they don't really understand how it affects children or people in high school, like at a later stage. And yeah, we also see that, and we're also using platforms now, like you said, TikTok, to educate other people, and you see that really helps. And I think that's really good. And at the same time, I also think it's sad that that's kind of the way we have to do it, that we cannot convince schools enough that it's so important. So I think that's still a big gap that we need to fill here.
Yes,
I was wondering, do you see that changing now? Because I get the impression that due to Corona, schools and in general people have more awareness for the importance of mental health, or how basic things like your friends are so important for your mental health. So do you see change in the current climate?
I see a small change, I think. I've been talking to schools and universities, and I see they're more willing to talk about resources they have, or like where someone can go to if they need help. But they all want to keep it, they don't really want to go into depth after that. So they're just like, here's a page with things you can, like websites you can visit or people you can go to, but we're not gonna do anything about it. We're not gonna, you cannot talk to us, or we're not gonna hire anyone to talk about mental health. So I feel like they are in a way listening to their students, but not in the way they want to be heard.
Thank you for sharing that, May. I would like to give Nick the floor to share his thoughts. So Nick, sorry, you're still muted. Yeah, don't worry.
Someone had to do it properly. So I just wanted to, I guess, highlight again the idea of, it's interesting, at least your question about, I think schools, from what I've noticed, I think they're aware that obviously the pandemic, and I know there's a specific talking point on that later, but the pandemic has impacted young people's well-being in various ways. I don't know if there's, I don't know if there's been any sudden, and this will obviously be country by country, but any sudden kind of like supports, funding for schools to then be able to pay for mental health services in their school, whether that's like actual therapy or counseling, or education programs and workshops and such. Quite a while ago, just when we started, one of our Euro Youth mental health key kind of things was around mental health needs to be on the curriculum in schools across Europe the same way physical health is, or PE as it's known in the UK, and that sort of thing. And it just reignited my sort of, should we redo this again, sort of thinking cap, already added it to our jam board. Yeah, so I think I still am a bit skeptical. I know in the UK, for instance, a charity is now trying to raise funds so that schools can apply to get funds from them to then get services to come into their school, but that's only going to be on a school by school basis, and there's been no kind of like government initiative. Yeah, I've kind of lost. I'm talking now about thinking. Yeah, it's just an interesting point. I think schools obviously do need to think about this going forward, but it'll be interesting to see if and what they do country by country.
Yes, so Nick, you're saying that it's not necessarily structural, that the attention is getting there, but that there is not a structural solution for it so far. Maybe Andrés, would you mind sharing something about the situation in Spain? Do you have any structural ways in schools to talk about mental health?
There's actually none. Well, none theoretically. Again, there are some courses in which psychology is taught, but only on a theoretical basis, not on a so to say mutual support or on or this kind of purpose, on a practical purpose. There is this figure in schools and high schools of school psychologists, so to say, that acts more actually like a counselor. It's a person to whom students can go at some point to talk about their mental health problems, but it's actually not for that. It's actually for it's more like, yeah, like a career counselor or someone who works or who provides the adaptations for children with special necessities, special needs, or talks to problematic families, or families with social issues. The fact is that there is no standing there is no no mental health network outside of the mental health network proper, so to say.
Okay, thank you. And I would actually like to ask the same question as well to Mehmet, so that we have all the countries that we have here now also represented. Do you have anything within school systems or educational systems related to youth mental health?
Mm-hmm. Well, I would like to start with that. I agree with Matthew, because of I think we really have a long way to go. That's why let's talk about the basis. When you say mental health, I mean, when you call it health, it recalls a disorder. So people, especially younger people, and they have, yes, complicated demands. You know, they want to, especially in adolescence, they need some advisory, I mean, consultancy from somebody or a center who does not call health, because of that when he applied to a health center, he has a fear of being stigmatized, you know. So I think we need a teamwork, working with, I mean, a primary care mental health worker, working with some social groups, but in primary care, in a community-based, in community-based services. In Turkey, the last decade, we are trying to get into a community-based health service But is this enough? No. I think in Turkey we don't have a structured guideline to help or to educate younger people. We need a structured guideline. We don't, yes, we have a government policy. It cares about mental health, but I think the basics are missed by this policy. We are just in the current policy, we are focusing on the pathologies, but the more important is we should give a service of people, give people service for especially young people and normal mental health. I mean, and what's normal mental health? In adolescence, they need to get some normalities, like what is normalities? Normal, usual sleeping patterns, coping and solving problems, like
so Mehmet,
interpersonal skills. They need some advisory service. But in Turkey, at the moment, we don't have such a service, but I am hopeful about that because we are started to give a service, give a community-based service in Turkey.
I think it's interesting you say that, Mehmet, also because it touches upon what Elisa said earlier on, okay, what is mental health and how do we define it and what kind of what kind of structure should we give to that? Okay.
Yes, the definition is most important thing, because what it recalls is more important. That directs people come asking for help or not. Yeah. So in our polyclinics, we see young people, but most of them have fear of being stigmatized. You know, so I think focusing on disorder and in psychopathology is not enough anymore.
Clear. Thank you, Mehmet. And I think this also touches upon what we discussed earlier. I see some questions being asked in the chat as well, so I would also like to invite the people from the chat to actually ask a question. Lisanna, would you like to share your question about counselors in schools?
Sure. Hi. I was just wondering, so from my experience in French schools, for example, the person who will be a mental health counselor is also often the person who will be a guidance counselor for higher education or for managing your school agenda or for very different aspects of your school life. I was just wondering, what are your experiences with this? Is it a model that is often repeated in your respective countries? And what are your thoughts on this? Should it be, is it useful for one person to follow up with young people, to have one face that people can go to for different aspects? Or would it be better to have two separate contacts, for example, one person that is mental health dedicated and one that is more school related, let's say?
So I would like to actually answer your question. For me, it can be the same person, but the thing is that it cannot be one person dedicated to a whole high school of 1,000 students, so to say. It all depends on the ratio of personnel being in there. I think there are, because they, as this sort of guidance mental health counselor-ish figure, they can be an intermediate person that can be for the students before going to the actual so to say psychiatrist, psychologist, etc. So an intermediate figure in that. And I think that that's a figure that can be the same one. Like if they have mental health training, of course, they should have But they also have, because they also have to deal with the psychological problems of children that need special education, that need a different kind of adaptation, and that's all interrelated. For me, it's not a thing about if it's the same person or not. It's about, please let us be more than, let us have more than one person per 1,000 students, please.
And I actually see Ivona thinking. Ivona, would you also like to share on it?
Me?
Yeah, yes, sorry.
Okay, because Nick raised his hand, so I wasn't prepared. I thought that you firstly. Well, I was just thinking about how is in Croatia, and I think that in our educational system, the biggest problem is that we are missing, as Andrés said, we are missing people who will deal with these problems, because mental health problems are, well, when we have like a physical problem, you go to the doctor, you have a therapy, which is really like continuous in a way, and you deal with that problem. With mental health, there is like really, it's not only about health system, it's also about educational system, it's about social aware system and so on. So I think when we talk about schools, that it's really difficult to cope with such problems when there is not enough people in there to cope with children's problems. I don't know if you understand what I'm trying to say.
Thank you, Ivona. To me, that was clear. Also, sorry for asking you the question for
No,
making
it's
you
okay.
confused.
It's okay. Yeah.
I was just curious to learn the background from Croatia. I see that Nick has raised his hand. Nick, would you like to share your thoughts? So Nick, here we go again. Thank you.
I'm just playing up to the stereotypes of the current times. So it's interesting. I'm going to talk specifically from the UK point of view, because it's interesting, this idea of, I think in a lot of, so as a participation worker in the UK, I'm passionate about that sort of role. You know, I have a dedicated role to including young people in mental health delivery, practice, governance, policy, but participation as a kind of profession is very much seen as someone can kind of do that alongside their assistant psychology role, which is what often happens in the clinical teams in the UK. And similarly, you have this role called pastoral worker in the UK in schools, who covers, you know, general mental health well-being conversations, learning assistant, for those maybe with learning difficulties, one-to-one teaching assistant covers the plethora of stuff. But what I will say is they don't do counselling in that formal language. They have that, but then a counsellor is a very different role, and there's a specific qualification that you have to have. And if you're a counsellor in a school, that is what you do. You're just a counsellor. Rightly so, personally, because I think it's can be a very highly intensive job, and I don't think you want them to be focusing on that. But this goes to another conversation about differences in each country of what counselling means. What does that look like in different countries? But yeah, I think in the UK, very much they keep it separate. But I know that it is quite common for that person A to be called a counsellor, and then to cover higher education advice, careers advice, and just to be more general and to related to pop culture. I thought of Mr. Mackey in South Park, who seemingly takes on everything. You know, anytime there's an incident at the school, no matter what it's about, it ends up with him, whether it's marriage counselling or someone's got some sort of dietary need. He deals with everything, and it's that person who they don't know who else to turn to. And I don't know if that is where that is, what countries that is the same in. But yeah, I think counselling is, there needs to be a separation personally.
Thank you, Nick. Given that we've been talking for quite some time now, I'm going to allow for a 5-minute break, especially given that we can get some water, just go to the toilet, and we'll meet each other again at 4:45. And then I'm also happy to start with the question that Andrea posted in the chat earlier. So 5-minute break, I'm back at 45. So welcome back. We'll just give it a few more minutes because I suppose that people need a little bit more time to get some water. Welcome back, Ivana.
Well,
We'll just allow for a little bit more time for Andrés, Elisa, and Matthew to come back. So Nick, if you are there. In the meantime, when we are waiting for André, I saw your message in the chat just now. Could you share a little bit more what you would mean by an overview of youth mental health organizations? So what would classify as youth mental health organization in this case?
Yeah, apologies for the shameless plug. Yeah, into I guess youth mental health organizations and I guess youth mental health organizations, because there's two separate entities. So there's youth organizations, and most of which, at least European-wide, have mental health on the agenda somewhere or another at the moment. And we're just keen to map the projects and the great work that's going on across Europe. And some people can share good practice and kind of learn from each other. Similarly then, yeah, youth mental health organizations, any mental health organization, I guess that can be a charity, it can be a clinical institution, you know, a psychiatric institution that work with young people. We're keen to kind of have them on board as well. We want to try and create a a page and a set of pages that people can go to and see what's going on across Europe in terms of youth mental health. And as part of that, there's going to be, you know, there's these organizations, but we're also going to try and get some short stories of young people's experience from each of those countries to go on those pages as well, as we look to get young people more involved in using their experiences to make positive change.
Can it be local initiatives as well, Nick? So just
yeah,
okay,
absolutely.
Okay.
Yeah. International, national, and local.
Perfect. Okay, that's just what I wanted to check with you. So now we're back from break. I would actually like to mention the question that was posed in the chat by Andrea before. She said, like we mentioned social media earlier, and she would like to hear an opinion of number of young people, whether they whether they share more freely their problems in a virtual space and how technology affects this issue. Can we consider technology as an assisted form of therapy? So feel free to share your thoughts on this one.
I'm not an expert on this, but I do know that in the Netherlands we offer a lot of online chat rooms for young people, so that are free and anonymous. So if they have questions or concerns or seek help, they can go to these chat boxes and speak with counselors that give them some first advice, and also tell them where to go, where they can go to. And especially this year with Corona, with COVID, many organizations joined forces, and they created one platform where all these chat boxes are combined.
Connected. Yeah.
Yeah, connected. Yeah. I don't know how it is in other countries.
I saw Andrés raise his hand just now.
Yeah. On one hand, I think that of course virtual space is now the way to go, or one of the ways to go. I think it should not be the ideal way to go, but it's the way it is. And as Elisa said, regarding the coronavirus pandemic, it's been very widespread. The therapy, and what's not therapy, and just counseling and mental health in general via virtual means. We have had to provide virtual therapy to to some of my patients. I had to do it in the same chair like some months ago. That's a thing. I mean, it's changing, of course, how everything goes, and I would be nonetheless skeptical of this, so to say. When I read technology assisted therapy, I was like, no, please, no, not in the sense of applications that partake in your mental health, or something that is robotized to the point that we lose the humanization of what's mental health. No, one does not need like a guideline of what to do, what not to do, and just like an application that gives you quantities or something like that. I think that could be a bit of a mistake on our part, because that's when people are seeking mental health, people seek connection with the other. When the connection with the other is done via virtual means, well, that's the thing. That's still a connection, even on the other side of the screen. If you're writing on a chat box and someone's that's not an AI is answering you, that's another person that's attending to you. But if you go to an app, it's like I was last week I downloaded one of the applications that was developed by the Catalan Department of Health for professionals looking for help, or that had burnt out systems, and the advice they gave was so bullshit. Sorry for the words. It looks like so bad. It's like no one is taking this seriously. Let's talk to people. Go to there are no, probably because there are no resources or no people available at some times. But that was like some like, yeah, no. That's at some point it's actually harmful, or can be harmful.
And Andrés, to what extent can technology be helpful? So is there anything specific that you do think technology is helpful in with regard to youth mental health? Yeah.
Yes. I think that everything that allows for communication, everything that allows for easier access to therapists or to consults, or for example, that some people that are away from home, not only, well, now it's like it's like more common because of the pandemic, but before that, people who are working as expats in other countries and want someone to talk that's in their own native language, that's available via technology. Even applications that allow you to register your mood or to allow for you to develop some patterns, but are used only as specific aids to some specific things, not as a whole mental health toolbox. No, I think this thought of replacing mental health professionals with AI, so with robots, it's completely well, anything that goes in that direction is completely off limits for me.
Yes, thank you. I just wanted to check with you on clarification on which things you do think are helpful. Yeah. So Ivona has raised her hand for some time now. Ivona, would you like to share?
Yeah, well, I'm not sure if I get the question correctly, but I think that maybe Andrea was also asking about sharing your mental health situation in general on social media. And I think that sometimes it can be good because, as Andres already told, people need the comfort of others. And if somebody finds somebody else who has the same problems, then they will feel connected and they will find comfort in this. But also, I think the biggest problem with the internet is there is a bunch of anonymous haters who can judge people. And I think that there is a big risk of sharing on social media. And if people want to share, they would, I think, have to really think what is for them comfortable to other people to know about them. And also about other things on social media, like you talked about bots and chats and things about that. I don't think that anything can replace psychotherapy and counseling in face-to-face. But in my experience, I volunteered on Brave Phone for quite a few years, which is a helpline for children and parents in Croatia. And youth are more and more used to chat these days. And so I think that we also have to think about how today's youth is communicating. So sometimes maybe for introduction and making a connection with youth, we have to think about other platforms than face-to-face, and afterwards we can change to that direction.
Mm-hmm. So you're suggesting to also adapt to what the youth is using nowadays, is something that Matthew also touched upon earlier. Like, we need to bring the conversation to where the youth is itself.
Yeah, I think that well, in my experience, for example, when you chat, it takes time, and you can chat for 2 hours about something, which I think in face-to-face conversation would take for like a half an hour. But I think that we have to think about how youth is communicating today, what is comfortable for them, and that is why we have to consider some different tools which probably some older generations aren't used to, and see what can we take from them. And yeah, that's all for me.
Yeah, I think you're touching upon something interesting. I would like to acknowledge that I do see Nick and May their hands, but I would allow for Matthew first, because I think you may have a direct reaction on the platform itself. Oh, you're still muted, Matthew.
I think there are different kinds of people and different age groups who would react differently to chats and calls. I agree with AI. I'm very skeptical of AI. when it comes to human interaction, because there are so many variables that I can't imagine how in one lifetime there's enough algorithms that will make it work for each and every person who signs up for it. And if I'm buying some kind of appliance and I realize it's a robot, it's one thing. But if it's my mental health and it took me years to come up to talk to someone, and then I realize that it's a robot and it's not helping me, definitely it's going to affect my mental health and much more than that. But I do think that, for example, my company, we created this TikTok channel about sex education because it's one of the things that we do. And the amount of young people who come there and ask questions, sometimes anonymously, sometimes in private messages, sometimes they visit our clinic. And we're dabbling in something similar for mental health. So I think it is very important to be as available as possible. When I was much younger myself, pre-internet, I used to do some youth work, and we used to go to the town centers, and people were places where youth used to hang out. Nowadays, and we used to have chats with them. Nowadays, I feel that most of the youth are hanging out online. So being there and offering that support is very important. I remember one of the clients I used to work with some years ago. She used to come to the clinic and we used to WhatsApp while she is in the clinic, because she found it extremely difficult to talk about the abuse that she suffered. So there, and even when at Willingness we switched to online because of COVID, I could see that there were clients who clammed up because of it's online, so they couldn't open up as much as they used to face. But there were others who were more open because they're in their bedroom or in their own living room on their own sofa, and it feels more personal. So I think there's no right recipe, and that's what makes mental health so interesting and fascinating, that we need to be able to adapt to different age groups and different cultures as well.
Thank you, Matthew. I also think you touch upon something interesting with culture, because this is also what was mentioned earlier, like that online space can also allow for people to have counseling in their own language, so to be a little bit more comfortable. Nick, I would like to hear from you what you would like to share. I'm very sorry about it.
It's okay, it's okay. I blocked it before you said it. Can I just to commend, it is Matthew, isn't it, in the Willingness team? Is that right? Yeah. On what that person that you're working with, where you were talking via WhatsApp, even when they were in the clinic, I think that's incredibly, that kind of creativity and outside the box thinking is what is needed in mental health in general, actually, to support young people. I just want to say how amazing that is. I think your question, yeah, social media, I've written a couple of things, but so one of the things I think about, I completely agree with Matthew that I think what this does is it offers choice to young people to engage in supportive conversations around their mental health. And there, I've seen in the UK, we've seen an uptick. Initially, I think it's plateaued, but initially we saw a bigger uptake in young men, boys kind of accessing tech services and online videos, face-to-face kind of therapy with some of the staff at an organisation I work for in the UK. So I think there is a way of blending these technology and face-to-face work to do stuff. I think both have their pros, both have their cons. We're all aware of these, and it's a case of recognizing that. Some of the one-to-one work I've done with young people's, I think, on video. So what you don't get, obviously, so currently, and I'm gonna use a prime example, I've been sat here with my lovely fancy Euro youth looking background. So if I was a young person and you have been trying to support me, now if you were meeting someone in person as a social worker, I'm thinking if you go to their house or meet them with their parents, you clock other things, about maybe the cleanliness of the place, and this is thinking about safeguarding types of things, about neglect. about how they interact with their parents. You don't see any of that with this. This is a filter. So young people can put a filter on to some of the truths that maybe they're not ready to tell you. And again, that could be, at least they're engaging. You might is a pro to take from that though, but at the same time you miss that thing. So I'm just gonna do that now for the rest of this. This is the second bedroom. It's not as nice as the main one. And so that's one of the pros and cons, you know, about sharing is the filters and things that people can put on digital to hide things. And then I guess in terms of sharing stories on social media, so we at Euro Youth Mental Health, and I guess in my practice and participation is about, I think it's great to have young people and people share their lived experiences with the world. If they're, you know, in a good enough place to, they're aware it's there forever once it's out. And I think, but what I recommend, and I'm a strong advocate for where possible, is that, I mean, initially you try and do it with an organization to give you that support. So again, shameless plug, sorry everyone, but like us or someone more local or national, you know, in the UK, you've got Young Minds who do a lot of that sort of stuff, because there's a team around your kind of your sharing of your story initially. You might go on to create your own Facebook or YouTube channel and whatever. And I guess we always suggest that you don't do that until you're at least over 18. But you can't stop some people under, you know, 14, 15-year-old, and that's to protect against potential trolling, or I think someone mentioned kind of just negative conversations and things that can come off that. So yeah, I think, you know, in answer to that question, is technology, I personally see that it has a lot of potential benefits for the future of supporting young people's mental health, but it should be a blended way of doing things. So, you know, the idea of maybe you start your work with someone online, or even if it's just texting, you make some goals to try and vary your methods of engagement, you know, maybe aim towards having a coffee at a train station for 10-15 minutes and so on and so forth. But yeah, short answer, it's given a lot of choice and an opportunity for young people to open up in ways they couldn't before.
And it depends on the way, so this is what I hear you say, it depends on the way that you use technology in the end as well.
Yeah, and there's, you know, there are protocols and measures that we suggest people use when engaging young people digitally. We deliver some training on it. I've been to training about it as well. And things to consider for safeguarding, for safety. So if you might be doing peer group work, you know, you have your, whereas in a physical space, you'd arrange chairs in a certain way, you might have a chill out room, and all of those sorts of things you don't have here. So how do you do that digitally and learn how to do that? But yeah, there's a space for both.
Yeah, it's the notion that facilitation done in the offline space cannot be translated directly to the online space, that you need to find ways to actually work it out, how it will work in the online space. Yeah. Okay. May, I know that you would also like to share on the topic, so feel free to also provide your perspective.
Yes, thank you. Yeah, I just wanted to add some things in terms of social media. I think it does have negative things, like it could be triggering, or people can just make comments and say whatever they want. But I do think there's a lot of beauty in social media as well. And I think we also spoke about this during the first day, that it's really underrated how much it can help other people to see, to read other stories and see what people have gone through. And I think social media is a really nice way to connect people and to show people they're not alone in what they're going through. And we see that on our platform every day, the number of people who come up to us, either privately or publicly, saying that it's of so much value that they can read other stories or have the possibility to share something. It's insanely high. And but we're also very cautious with it if we, because we share stories from other people through our platform, but they can never be under 18, and they also have to sign a form, so we're very cautious with that as well. And I think yeah, also platforms like TikTok, we don't have control over the people that watch it, like it could be 14-year-olds, of course. But I do think it helps a lot, and it shows people that they're really not alone. And yeah, again, I think that's really underrated how much that can help someone give a bit of hope in, you know, their recovery and all that. So that's what I want to say.
And May, I actually think that your answer also touches upon a question that is currently in the chat by Alexander. Alexander, would you mind asking the question yourself?
Yes, hi. So the question I have is mostly, as I said, I check a lot of forums online because mostly I'm affected by some mental health issues. And I've seen a lot of advice, be it on forums, apps, chat rooms. I deem it, as I have some years in therapy, I can understand when some advice is, let's say, useless or just toxic for some people, like what I mentioned, the toxic positivity. I've had it called by my therapist, for example, that it's entirely all about you can do it, anything is possible if you try. And there are other people who believe it, who actually think it's true. And how does it actually affect like the therapy of those people? Or is it an issue for professionals when they start a therapy with someone and someone has that entire notion that I can do anything and then burn themselves on it? They just realized after trying, I cannot actually do it. Is it an issue or is it just a minor thing? It's my question.
So whether the social media positivity interferes with the actual like therapy and the actual expectation management, that is what you're asking, like, Alexander? Yes, perfect. I see you nod. Ivona, feel free.
Well, I wanted to say that I think that this is a general problem. I think that in the problem of today's society, because we are educated that you are like a strong, complete person if you are able to do everything on your own, and like if you ask for help, that is something that is like weakness of yours in some kind of way. I will see. I'm really looking forward to hear if this is something that is also seen in other countries, because in Croatia, I think that it's really like that. And that's why I think that people are like really open to those kind of things, like this is top 5 things to make you feel better and stuff like that. And I think that this is something that can be useful to certain kind of people if you have some, like, I don't know, some little problem that you have to deal with and so on. But I think that we have to educate people in which point they need more than those like positive feedbacks, which can be useful, but only on a certain degree.
Yeah. Thank you, Ivona. I saw Andrés have a 2-finger or a direct comment. Would you like to share? Yeah.
Yeah, there was also another participant with the hand raised. I forgot you. Sorry, I forgot your name.
It's Matthew.
Matthew. So if you want to go first, please do.
You go.
Okay. So yeah, I fully agree with you, Alexander. That's true. I've never had this is called as toxic positivity, but it definitely is toxic. I think that's not in a personal level. I think that's not something that affects us in a personal level. This kind of messages, you can do it. Yes, you're wonderful. Life is wonderful. Life is brilliant. You can do whatever you want. I think it's a byproduct of the society, of the system, of this American styled based capitalism, in which if you succeed, then you like it's your individual power to do things. And it's not, definitely it's not. If you're born in the wrong country, if you're born in the wrong zip code, if you're wrong with the wrong family and in the wrong circumstances, you are not going to be able to do as many things or different things. You cannot do everything. There are disabilities, there are limitations, and there are limits, and that's something that has to be taken into account. And I think those messages give a really bad feeling, and it's also harmful when people read those messages and think, yeah, I have to, I can do it, and they cannot, and they feel bad. They feel even worse than before because they feel that the help they were seeking led them and like they were not worth. They are not well enough people, and that's inhuman in my opinion. Yeah.
So I see this topic actually raises a lot of interaction. So as Matthew had his hand up for quite some time, would you like to go first? And I saw you, Elisa, and I also saw you, Ivona, and I see you, Mehmet.
Yes, definitely. I mean, I agree with all that is being said about this toxic positivity and the idea of hearing a video every morning and your life will change. Or if you believe it, you can do it. However, I also remember attending media lessons, media awareness classes when I was younger. And during these classes, I was taught how to be a critical thinker and look at movies and learn what is true and what's not, and what is editing and what's not. So I think that it goes back to us professionals to make sure that our clients have the education that they need to understand what is possible and what's not possible. Because yes, definitely, when people are writing advice online, it could be beneficial for one person, it could be detrimental to another person's therapeutic process. But then it is about the therapist, the professional, and the educator to teach our clients and students what is okay and what's not okay, and how they can filter what they're seeing and what they're hearing every day. We can say the same thing about body image. Because again, I'm comparing mental health to physical health. I see a lot of personal trainers who tell me that I can get abs within 6 weeks or a year. But because I'm a critical thinker, I know that not everybody is malleable. And not everybody can have the six-pack that this personal trainer has. So it is the same thing with mental health, unfortunately. We need to be teaching people and making them aware what is possible and what's not possible.
Yes, that's a clear signal, Matthew. I'm very disappointed that I won't be getting my abs in 6 weeks, though. I saw Elisa before, so go ahead.
Yes, so that's a comment on what the other speaker said before, that it might seem that as an individual, you're responsible for your mental health. Whereas, of course, from research, we know that it depends on many factors. So not only personal factors, but also maybe things that happen in your environment, like how your family is doing and your friends, or traumatic events. And it can happen to everybody. So it also shows that mental health is this balance between the things that happen to you and the things you can bear. So in the Netherlands, we call it draagkracht, draaglast. Sorry for the Dutch, for the Dutch pronunciation. But it means that everybody can get imbalanced sometimes in life. And that it depends on multiple factors. And it also gives you direction on where to start again. So now I'm talking, of course, more about the prevention or the light mental health complaints, which is something different than serious mental health complaints where you do need psychologists for. But if you realize that you're feeling a bit stressed or anxious because your loved one just died, or you had a terrible car accident or things like that, you can, if you know that it's also a common response, and if you know what you can do about it, so for instance, talk to others which you trust about it, or seek activities that give you energy, or take good care of your body, that might also help. So I fully agree with what the other said, that it's a combination of micro factors, we call it in research, like the individual, and more macro level factors, like how is your environment doing, how is your school setting, how are your friends and family, and even more macro, what is your government doing in terms of policies, funding, opportunities. So I will end now because I can talk forever, but I just wanted to say that I think it's important to nuance, give nuanced picture.
Yes, and Elisa, I just want to ask a short follow-up question on that to you, because you're talking about that we make mental health very individualized, so that it is very up to the individual to actually do something about it. How do you see that we should be able to change this? So what approach would work in order that we de-individualize it and take it more onto a community level?
Yeah, I think it's about collaborations between organizations and individuals at multiple levels. Maybe just a really easy example: if you're a child which is born in a low SES family and there's financial stress, that might hurt the parenting style of the family and also impact your mental health as a child then. They might become more harsher in their parenting. So if we know that, and we also know if there's little money in the family, you might as a child not able to join social activities that your other age mates can. So what a government then can do, for instance, in the Netherlands, you have the sport passes, or these some municipalities give some small financial amounts on cards, which you can spend on nice things, but also taking sport classes, go to a fun park, and then these children can, via this small intervention, can be part of social life, some instances, and do things that also help their mental health. So it's twofold, because being part of doing stuff your age mate is also protective of how you're doing. So that's one example.
Yeah, thank you for the clear example, actually. May, you also would like to share something?
Not really. I definitely agree with Elisa, so I don't have any additional comments.
Okay, I was just checking because you had your hand up earlier. Mehmet, go ahead.
Yeah, thank you. Alexander, thank you for such a striking question. I think that maybe a major problem of using internet or social media for education or intervening to patients by psychotherapists or doctors. But I think this is an issue. It is not an issue of the tool we utilize for education or for intervening for psychotherapy. It is an issue of the advisor or the educator. Why? Because we can see such people, such advisors in the real life, not on just virtual social media. So I think it shouldn't mean that we shouldn't use internet or social media for education and for therapy. I would like to share my other opinions about using social media for therapy or education. Yes, I mostly agree with most of people here. Yeah, it is cheaper, it's more accessible and more comfortable. But I think there is another problem. We may miss what will happen. Can we guarantee, can we assure the privacy of the individual consulting us? This is another problem, I think, because in my polyclinic room, I can guarantee, I can assure him or her tell me whatever he wants or she wants to tell. But on internet, we cannot guarantee this. That may be a minor problem, but this is still a problem. And it is not an obstacle for using, for utilizing social media, of course, for education. But I think we need to reorganize to use social media or internet for education and for therapy. One another opinion for making therapy online. I have friends, colleagues making therapy, online therapies. I also follow one of my patients from Istanbul, which is a dissociative identity disorder, more than 5 years. But there is a limitation because this person sometimes need more invasive intervention, and online therapy has this limitation that you cannot invasively intervene this patient. I talk to her online with the Skype, maybe every month, one time every month, but I think it has a limitation. This limitation is very important in therapy. So thank you for listening. Yes.
I think, Mehmet, that you're touching upon that we need to consider how to use technology. So you are also saying, okay, we have to make technology in a way work that it actually works for the things that we want to do, so that we have to have our objectives for how we want to use it. So thank you actually for sharing that. As we have 4 minutes left for today, I would like to give the floor for the last question by André. André, would you mind sharing it yourself?
Sure, I can share it briefly. So my question is on what's your view on multidisciplinarity when it comes to mental health? We've touched on it a bit before, and I see on the one hand a lot of times that it's totally about pathologizing, and it's about psychologists and psychiatrists talking about the extreme end of the spectrum. And then on the other hand, I often see people who are really not supposed to do something, do it, like working with trauma when you have no qualification for that. So I'm wondering if we can find some middle ground, or what is your view on working with people of other disciplines?
Thank you for sharing it yourself, André. So I saw a lot of nodding. Who would like to share first? So Matthew, go ahead, take the floor.
I genuinely think that if we want to move into a more holistic way of being, which I honestly think that youths nowadays are getting more the hang of than previous generations, where you talk to youth who are not just immersing themselves in studies, but they want to participate in political organizations, have a voice, take care of their bodies, take care of their mental health. We have to level up our services and make sure that we're offering what these people need. So it is very important to have different kind of professionals working together to make sure that they can fulfill the needs of our youth. This also makes it easier for youth to access good information by professionals and not having to repeat the same story to each and every profession that they go to. I personally lead a multidisciplinary team, and I feel that I learn a lot from the different modalities and different professions, because I've been trained as a psychotherapist and counselor. Most of the time, people who did this go attend conferences which are done by some counselors and psychotherapists. The speakers would be the same, psychotherapists and counselors. So it is one way of looking at the world. So when you work with people from different professions, then I am being taught all the time how to look at the same person from a different perspective. And that gives me more tools to use with my clients, definitely.
Thank you, Matthew. Nick, would you like to share? I'm afraid to say it again.
Okay, I'm just going to crack on. Thank you. Thanks for the question. I think absolutely it needs to be something that is spread across as a responsibility of a variety of professionals and platforms. As Matthew just mentioned about a holistic approach, mental health, back in the day was very much seen as something only doctors and GPs in the UK would have to deal with or worry about or even talk about. And yeah, I think, the term parity of esteem, kind of the idea of linking mental health up to the awareness and the public knowledge is the same way that physical health is. We all kind of learnt through a variety of methods, really, through youth club, our sports team, our school, universities, our parents about the importance of being active, doing yoga, running, sports, eating right, you know, what you should eat, what you shouldn't eat, all of this stuff. I'm personally just think, and I just think that mental health just needs to slot in alongside it as the same sort of thing. And so in schools, it's got the equal measure of kind of involvement. And it is getting there. Again, it might be because of the bubble I'm in, but you know, it is getting there. There are a lot, you know, mental health is something that is involved in every social worker's piece of work, and you know, every teacher, the schools. Yes, Bobby, you're right. Schools very much mental health, at least definitely in the UK, and I know in some countries in Europe it is becoming more common for it to be part of whether it's still just a couple of workshops over the year or it's starting to filter into the school curriculum. And similarly, you know, in just all of our in day-to-day life, you know, having it in the newspaper, having someone on the news talking about their experiences and those sorts of things. The superstars of mental health, if you will, like you've got the superstars of living physically healthily, you know, your athletes and such, are slowly starting to gain momentum. And so, yeah, I just think it's an absolute must. And it's a bit of a it's like a public health thing, isn't it? I remember diet was a big public health. I'm from Wales originally, South Wales. I have a massive obesity, numbers of high obesity, always have. And so I remember there was a big campaign about eating healthily and that sort of thing back when I was a kid. I don't think it changed much. I think we ate all right anyway, but I feel like that is the way that maybe mental health could go or can go to as providing that input.
Yes, thank you for making that connection, actually, Nick. Given the time, I will allow Ivona to share her last thoughts on the interdisciplinary approach, and then we will wrap up for today.
Okay, thank you. Well, I agree with everybody. I think that multidisciplinary approach is really important, and it gives a lot of new insights that maybe somebody who is, for example, like me, a psychologist, doesn't have. But still, I think that it is really important that this multidisciplinary approach is handled with different professionals, because sometimes we talked about like toxic positivity, and we have many books that are called like popular psychology, which seems really logical with like really good examples and so on, but it can give like totally different advices. So to sum up, I agree with multidisciplinary approach, but it has to stay in the field of professionals who are dealing with mental health in some kind of holistic way.
That's very clear, Ivona. So given the time, I would actually really like to thank you for being here today on our panel. So Andrés, Ivona, May, Matthew, Elisa, Mehmet, and Nick, thank you very much for participating today. I think we've covered a very wide range of topics. So from prevention to social media, from embedding mental health and education to interdisciplinary approaches. So thank you so much for sharing your thoughts. And it was really lovely to have you.
Yeah, it's a pleasure.
Thanks, AEGEE. Thanks, Liz. Great.
Thank you. Thank you for having me.
Thank you.
Bye.
Bye.
Good evening.
Bye.
Bye-bye.
And for the rest of you, at 6 o'clock, we will have the workshop Mind to Mind from EPSA, and you can enter with the same link, and we will allow the first 30 participants to enter. So I hope to see you in half an hour.
Thank you for actually sharing, Nelleke. I'm very sorry for forgetting.
That's fine.